All
Yes.
right. Our first presenter is Jake Horowitz from Offcall, talking about fixing referrals for independent practices. Jake Horowitz is a two-time entrepreneur and CEO and co-founder of Offcall. Previously, he co-founded Mike, or MIC, I guess. Um, is that how you pronounce it, Mike?
Yep.
All right. Uh, and it is a leading digital media company. His mission is centered on supporting clinicians by building tools that restore well-being, efficiency, and sustainability. Welcome, Jake. He's a Stanford grad, and so great to see you. Go
Thank
ahead, the
you.
stage.
Okay, perfect. I wasn't sure if you were going to introduce everybody first. Um, Nice to see everybody. Nice to meet everybody. I'm going to share my screen. I've got a few slides. And I heard Dawn was excited about referrals, so very, very excited to meet you, Dawn, and get into it. Um, I Hopefully you can see my screen. I'm excited to talk to
Yes.
everybody today about Offcall. That's my company. I am working on fixing referrals, starting with independent practices, physicians and practices. That the mission of Offcall is really to restore wealth and well-being and a sense of autonomy to physicians. We have an amazing team. We're working with my co-founder is Dr. Graham Walker, who some of you may know. He founded MDCalc. That was his first company, a clinical decision tool for physicians that 80% of doctors use every day. And we've got an amazing team of physician advisors and entrepreneurs, over 35 doctors supporting the project, physicians supporting the project, in addition to some venture funds like Bloomberg Beta and Roar Ventures and several others. The goal is to try to fix what is one of the most broken but important workflows in all of medicine, which is referrals. Everybody on this call knows that, but I mean the numbers are staggering. You know, there's 150 million specialist referrals sent every year. It's up 375%. And will continue to rise and grow as care gets more fragmented. 50% of the referrals never get to the right place. They just don't get processed, or there's leakage or handoff gaps. Dawn and maybe others are living that and breathing that. You know, for independence, once you're outside of the big systems, there is no system to actually send and receive these referrals on the same network. And even for health systems that are on a system, you know, redirecting patients that they can't see with long wait times, or building rapport or referral relationships outside of the four walls of the hospital, or understanding what's happening outside of the four walls of the hospital is still really, really hard. And so what we are trying to do is, you know, really fix what is one of the biggest physician workflow pain points, the biggest things that physicians struggle with daily. You know, we surveyed over 1,000 doctors. We asked them, what is the top use of AI that you'd like to see? And admin pain and overcoming and fixing and getting rid of the fax machine was actually number one, above clinical decision support, or any of the sort of sexy use cases. And so we spent like 3 or 4 months just shadowing doctors in independent practices and understanding their workflow, and shadowing the referral coordinators and the staff and understanding their workflow, and trying to figure out where are all the little brutal pain points and gaps, and where do things fall through, and how could we engineer a system that would really be beloved from the physician perspective and the staff perspective. And what we've really come to believe at Offcall is that it's like a two-pronged or multi-pronged problem. So one piece is like actually knowing who to refer to in the community, and having relationships and a network and a open communication channel to other specialists and PCPs. Unless you've been practicing for 40 years in a community, like it's really, really hard to do, as things are really fragmented. And then once you do have those relationships, you know, the facts and the prior auth and the scheduling and the no tracking and the closed box and no feedback loop. I mean, all those problems that everybody on this call knows, you know, that's where we think that AI can make a lot of the most manual and difficult, tedious parts of the process go away. And so we're excited to do this now because number one, referral volume is exploding and will continue to do so. It's clearly overwhelmed the existing workflows for independent practices. They're all on these fragmented fax, phone, manual coordination workflows. And we really feel like now is the time between the hardest parts of the process, which is the maintaining the directory, matching to the right specialist, the routing, the tracking, manual document upload, putting it into all the right details into your EMR, like all of those things, AI can now make much, much, much better. And so we've designed the system from the ground up. It's been really, really fun over the last several months to work with an amazing set of engineers and physicians and just like literally think about this problem every single day and figure out what is the dream solution here, the magic solution. Our system that we've built is both a mobile app and a desktop app where physicians can find one another, search by preferred referrals, by specialty, by zip code, by a whole set of criteria, find the right in-network specialist, be able to schedule, make a referral and schedule their patient with the receiving provider, and then tracking the status. And we built like a DoorDash, Domino's pizza tracker style, tracking the status of these referrals and seeing where are they in the process and has the patient been accepted and have they been seen? And we're really trying to close the loop. And as I mentioned, just automating a lot of the really manual parts of the workflow, from the verification to matching with the right specialist, prior auth. We're really excited about how we can take these very manual processes and make them a beloved experience both for the staff and the practice as well as for the physician. We're seeing incredible engagement, and it's just been amazing to see physicians start to like change the way that they're sending these, build relationships. The networks are starting to form in our early pilot markets. Been able to scale really quickly from one to many practices, and it's spreading via word of mouth. And referrals are really an amazing network effect type of product, right? So when somebody gets on and they bring their referral network on, people are starting to now change the way they're doing referrals and run them through Offcall, which is really amazing. And the approach we're taking on the go-to-market side is very, very hyper-local. So we've decided that since this is such a hyper-local community-based thing, rolling this out city by city, geography by geography is the way to build density on these networks. And so we've done our first network in Columbus, Ohio. Shout out if anybody's in Ohio, would love to talk to you. But Columbus, Ohio, we're about to roll out our next network just next week in a really exciting new place, which I can share more about with about 5,000 doctors. And the whole idea here is like go city to city, unlock density in these networks, and target both the PCPs as well as the specialists, bring them onto the network and build a new communication and network tool as well as a workflow tool. And then quickly, I'll just wrap up because I know we're coming up on time. Offcall has really figured out a secret sauce or a formula to reach physicians all across the US. We've built this huge network of doctors. We've done it through, content and through social media and through a platform that really speaks to doctors. And so we've got podcasts and webinars and a lot of the things that this community is doing, but like we've really figured out how to engage huge groups of physicians. And so as we get to scale in these markets, we think this is going to be a really unfair advantage that allows us to actually do this. Because a lot of people have tried this, but actually do this and actually be able to unlock density in these markets. So yeah, that's a bit about what we're doing. I'd love to take questions on the business side. We're experimenting with various models, but we're going to, the basic idea is specialist practices as we achieve density in these markets, specialist practices that are receiving a lot of referrals, using this as a new tool for the practice to receive referrals, take work out of the system. We're going to charge specialist practices, not the primary care practices. And the path to it becoming a really large business, is 100 practices, then 1,000 practices, then 2,000 practices as we get into these markets. This ends up becoming a really, really big business. And this is a very large underserved market, just owning referrals alone. And then as we own referrals, we're going to expand into other parts of the sort of independent practice workflow, the coordination workflow, and practice workflows, where where being in the daily workflow and being in the practice stack allows us to do really, really interesting things for independent practices. So I'll pause there. We're super, super excited. I could talk more about our roadmap and competitors, but we're super excited about this and very excited about this community because this is exactly the kind of group we want to be talking to. And so thank you for putting this together.
Sure. Thanks, Jake. If anybody has any questions, please raise your hand so that I can bring you in. Um, One question I had was, does this have to be, or is this integrated with the EHR that you may be using, and how do you do that?
Yeah, not yet. So we built it intentionally outside of the HR, but that's the number one thing on the roadmap is to work with our specialist practices and integrate so those scheduling modules and then the transferring documents and patient detail modules are automatically transported into Offcall as we integrate. So that's coming.
Okay. So does that mean you'll be, in their app garden or app orchard and people can use
Yeah,
you
depending
or
on depending on which one. So like Athena, for example, Athena Marketplace, you can get on the Athena
yeah,
Marketplace for the practices that are on Athena. For some of the smaller niche EHRs, there's actually like Chrome extensions that you can build that's basically sits on top of the EHR and scrapes the information needed for the referral. So you never have to actually leave the EHR, but it basically processes it for you and runs it through off call. So we're looking at both paths depending on the specialty and the size of the practice.
got it, got it. Let's see, I see a few hands raised. Don, go ahead. Unmute yourself and ask the question.
Thank you for presenting. Interesting. Can you handle volume like 5,000 referrals a month?
Yes. Yes, we can handle 5,000 referrals a month.
Yeah, we should
Yeah,
talk.
we've built it to scale in exactly that way. So yeah, I would love to talk.
Yeah, thank you.
There you go. Your first customer from here.
And I see one of
Sue,
my favorite people, Susan.
Susan. Okay, Susan, go ahead.
Jake,
Oh,
I'm so excited that you're
Yes, there
on
she
with
is. I
Uli.
love
Yes,
Susan.
that is exciting. Uli's great. He's with good people all the time. So it's a great move. So I wanted to say that I think this is a great plan. I think one of the biggest problems for independent physicians is we're independent, but all the specialists are not. And so they're in this network that it's hard to get an appointment for them. So if we can do it this way, it's easier to get the patient in this
Yeah.
way versus having the patient call or we're forced to call. And that's a real headache. So this really creates a bottleneck, a barrier for the independent
Yeah.
physician. So that's really positive. Of course, doing other things like prior auth verification, that just makes it easier. The front desk doesn't have to do it, it's done on the app. One suggestion that you should do, since you work with independent practices, just an idea to put in your head. A lot of independent practices are having trouble recruiting physicians to work for them or take over their practices. It's just
Mm.
they're afraid. And if you look a lot in the literatures written by the independent or business physicians, doctors graduating right now are afraid. They don't know the business model, how to feel that they can actually do it, but they can. And so, especially with tools that you're building, it makes it easier. That's something that you should explore, business classes or business, I don't know, getting them not afraid and to be brave and to take over or join.
Susan, I appreciate both your comments so much. On the second point, we really do see, and hopefully this is news to your ears. I know it will be, but we really do see, especially among younger doctors, a swing back to an interest in independence and trying to find new models and ways to do this. And I do think in the next 5 to 10 years, will we see more doctors trying to figure out a new way to practice independently? Yes. And a new suite of tools to do that, and a new community that they need in order to do that. I think we can be a big part of that at Offcall. So I appreciate that comment. And then on the first point that you made, about the specialist, I mean, 100%. And what we're seeing in the early market with our PCPs, the PCPs absolutely love using this, because right now the process is like they're expected to quarterback care for their patients, but they don't want to be responsible for like 9 month wait times or 6 month wait
No,
times.
right.
And they want to find the exact perfect specialist that can see their patient and get a rave review from their patient. Like, you've given me the perfect referral. And that's now happened so many times I hear these stories every week in our pilot in Columbus, where the PCP comes to me and says, you know what, like, my patient came to me and said they've never been happier with my care because of a referral I made through Offcall, because you guys have the perfect network for this. So, and then on the specialist side, you're 100% right. They can see these people same day if you're
They
independent. Like,
can.
people can
And they're
see them
sitting
same day
around. They
or
always
next day.
complain.
Yeah. And so, like, a cardiologist, literally this morning, cardiologist texted me, said, I got a referral this morning from Offcall from one of your PCPs. Like, this is incredible, this tool that you've built. I can see this patient the same day. And he's one of the few independent cardiologists in Columbus. So I think it's on both sides, there's real value. And you're absolutely right. It's like building your network outside of the system and keeping that network with you, and then being able to form these relationships, and cement these relationships. That's really the exciting part here.
Oh,
Oh,
definitely.
I see a poll and a quiz.
Yes. People who want to connect with Jake. Yeah, one suggestion, Jake. I think last week, was it last week? We had the UberDoc CEO.
Oh,
Now
perfect.
it's a different name,
Yeah.
but she was there. She presented, how her journey and how she went IPO and all that. But that would be a good match, man. They find the specialists and get the appointments, and you get the referrals.
Yes.
So
Yes. That's a
you
good,
should talk with.
that's a good intro. I'd love that. And Dawn, I'd love to speak with you. I'll follow up with you. And yeah, anybody else, thank you so much. I'll put my email in the chat. It'd be great to connect.
All right. Thank you very much, Jake. Let's bring in.